Welcome to the OmniDental Podcast.
We're glad you could join us.
Today we're doing a deep dive into something really interesting, a journey of professional growth that, honestly, has a direct impact on the dental care available right here in our community. We're going to unpack an intensive week of advanced surgical training that took place down in South America at ILAPEO College in Curitiba, Brazil.
Yeah, and what's really fascinating here, I think, is this constant drive for excellence you see in dentistry.
Right.
It's a field that's always changing, new research, new tech all the time. So staying ahead means, well, it means looking beyond just what's happening locally.
Going global.
Exactly, engaging with global innovations.
Yeah.
So this dive, it's not just about what was learned, but maybe more importantly, why this kind of international experience is so crucial for, lifting the bar on patient care.
Totally agree. It's not just about hanging another certificate on the wall, is it?
Not at all.
It's about bringing that truly world-class expertise back home, back to our community. We'll explore the specifics of what went on during this advanced training.
And then we'll connect the dots.
Yes, connect it right back to the services, the comprehensive dental and aesthetic care that you can find at OmniDental, serving Arlington Heights and the surrounding areas, too.
Showing how this international training translates into tangible benefits for patients.
Okay, so let's get into it. This trip to Brazil. Dr. Bislas Pols, who founded OmniDental and is the lead dentist there, he went down to ILAPEO College in Curitiba, this was August 2025, for a really intensive surgical training program. Sounds like more than just a course, like a real immersion.
It really does. And, it makes you ask, why ILAPEO specifically?
Good question.
Well, our sources highlight it's the Latin American Institute of Dental Research and Education. They've got more than 16 years focused on cutting-edge research and training. It's seen as a real sort of beacon of excellence in the global dental world.
A beacon, I like that.
Yeah, known for a tough academic program, expert faculty, like really top people from around the world, and this strong international reputation. It's basically where dentists go when they're serious about staying ahead clinically and technologically.
So definitely not just any old training course. This is like the place to be for this stuff.
Pretty much.
The whole thing started with a welcome dinner, August 11th. Sounds like it set a nice tone, fostering some camaraderie. And the people there, dentists from Latin America, North America, Europe, the Middle East, all together.
That mix is so important, isn't it?
Imagine the conversations.
Absolutely. That diversity of participants is really key. You get perspectives shaped by different healthcare systems, different patient needs.
Different approaches to solving problems.
Exactly. The program itself, it was called Advanced Surgeries, Bone Grafts with emphasis on sinus lifts. Very specific.
Okay.
It was designed explicitly for clinicians who already have experience but want to really refine their skills in some pretty complex dental implant procedures.
Right, taking it to the next level.
And the structure, it sounds really effective. They had classroom lectures, sure, but also live surgical demos.
Watching the experts in action.
And then, probably the most valuable part, hands-on surgeries on actual patients.
Wow, okay. That's where it gets really interesting for anyone curious about what high-level dentistry involves. So what were the key things they learned? What were those hands-on highlights?
Well, they covered a lot of ground critical for advanced implants. Things like detailed preoperative evaluation, super important for planning successful surgeries and avoiding issues down the line.
Makes sense. Planning is everything.
Definitely. But a really big focus was on managing what are called atrophic jaws.
Atrophic jaws, what does that mean exactly?
Basically, it's when the jawbone has shrunk or is very thin. Often happens after tooth loss, And it can make placing standard dental implants really difficult, sometimes impossible.
Okay. So a major roadblock for some patients wanting implants. How do they tackle that?
That's where the advanced grafting comes in. So they spend a lot of time on techniques using both autogenous bone.
That's the patient's own bone, right? From somewhere else.
Exactly. Often seen as the best because it's biologically compatible. But they also worked extensively with synthetic biomaterials. These are like engineered materials that help stimulate the body to grow new bone in that area.
Okay, so different tools for the job.
Right. And they mastered different approaches, like onlay and inlay grafting. You can think of onlay as adding bone on top of the existing jaw, maybe to increase height.
Got it.
And inlay is more about adding bone within a defect, maybe to increase the width or density. Plus, and this is important, they also looked at using specialized wide and short implants.
As an alternative.
Sometimes, yes. These implants are designed differently, so they might work well even when there's less bone available, potentially meaning less extensive grafting or maybe none at all for certain cases. That can simplify things a lot for the patient.
That sounds like it really opens up possibilities for people who might have been told no before.
That's the idea, expanding the options.
And you mentioned live surgeries, performed by top Brazilian surgeons. Seeing that happen in real time, the decision-making, how they handle unexpected things, that must be invaluable.
Absolutely. Just observing that level of expertise, the nuances.
But then they actually did the surgeries themselves. The source says each participant, Dr. Poles included, performed 2 full surgical cases, under supervision, of course.
Yes, 2 complete cases. And that hands-on part, it's just critical. It's where theory meets reality.
You can't beat actually doing it.
No, you really can't. It sharpens your adaptability, forces you to apply what you learned in a real dynamic situation, even with that expert safety net. It builds a kind of confidence and muscle memory that lectures alone just can't provide.
And doing it in a different clinical environment, too, probably reinforces the core principles, right? Quality care is quality care.
Precisely. It underscores that the fundamentals of patient safety and effective technique are universal. Dr. Poles might have faced a specific challenge during one of his cases, maybe an anatomical curveball. And getting that immediate feedback, that guidance from a master surgeon right then and there, that's learning that sticks.
So beyond the specific skills, it sounds like the whole atmosphere was about collaboration. Dr. Poles training alongside dentists from all over, everyone bringing their unique background.
That global exchange is huge. It gives you this comparative view on everything, different ways of doing things, how healthcare access varies, cost considerations. These are all things that shape how dentistry evolves globally.
Like seeing your own practice through a different lens.
Exactly. You might hear about a standard approach in, say, Europe for a certain issue, driven by their system or patient factors, and it sparks an idea for how to adapt something similar back home, maybe more efficiently. It makes knowledge more robust, more applicable across different contexts.
Yeah, it's easy to get stuck in your own bubble, isn't it? Thinking your way is the only way.
It is. But this course sounds like it actively broke down those silos. Just the exchange of ideas must have been incredible technique preferences, sure, but also how people are integrating things like 3D printing or the latest in cosmetic dentistry. It adds real depth.
A melting pot of dental innovation.
And ILAPEO itself seems designed for that. It's not just teaching what's known, it's positioned as an innovation hub.
How so?
Well, they have partnerships with major dental companies. So they're involved in testing new equipment, working on new biomaterials, pushing forward digital workflows in implantology, like a living lab.
Wow, so participants are getting exposure to what's coming next, too.
Seems like it.
Yeah.
The campus is described as really modern, well-equipped, reflecting that mission they have to train thinkers capable of revolutionizing the dental environment. It encourages looking ahead, pushing boundaries.
That's inspiring. So after all that intense work, Dr. Poles managed a quick trip to Rio, a bit of culture after the clinic.
Yeah, feels like a well-earned break. And sometimes, stepping back like that, experiencing something totally different, helps consolidate the learning, connect it all.
True. But the main goal, always, was bringing this advanced knowledge back.
Absolutely. And this is really the key takeaway for you, the listener, especially if you're in or around Arlington Heights. This trip wasn't just professional development for its own sake.
Right.
The source is clear. It was an investment, a significant one, aimed squarely at boosting the standard of care Dr. Poles can provide to his patients, to his community in the greater Chicago area. It's about bringing that global frontier of dentistry right here.
So let's translate that. What does this mean for someone walking into OmniDental? Dr. Poles already has, over a decade of experience across the board, general, cosmetic, restorative dentistry, implants, crowns, Invisalign, all on 4. He does a lot. But this specialized training in advanced bone grafts, sinus lifts, how does that specifically elevate things?
It significantly expands the clinic's capabilities, particularly for those really complex cases. Think about that patient we mentioned earlier, the one told they couldn't get implants because of severe bone loss.
Right.
Well, now, with this specific high-level training from ILAPEO, Dr. Poles has more advanced tools and techniques in his arsenal to potentially offer solutions. Solutions that maybe weren't on the table before.
So more options, potentially higher success rates for tricky situations.
Precisely. So whether you need a routine checkup, or you're thinking about cosmetic work, or you're facing one of these more complex oral surgery needs, the care you're getting is now backed by this enhanced global expertise. It reinforces that commitment OmniDental has to top-tier care, looking at immediate needs and long-term health, always putting the patient first.
And that commitment shows up in their comprehensive approach, right? From preventive care all the way through. Their facility uses state-of-the-art tech, too, which helps with precision, comfort.
Yes, the technology piece is important. Better diagnostics, more efficient treatment, more comfort during procedures. It all adds up to better outcomes for you.
And this advanced care isn't just in one spot. OmniDental serves Arlington Heights and a lot of the nearby areas, too.
That's right. Places like Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, Elk Grove Village. They're aiming to make this level of care accessible locally.
For anyone in those areas wanting to see what this elevated standard feels like, OmniDental is right there on Rand Road in Arlington Heights, 305E Rand Road, Arlington Heights, IL 6004, and the number is 847-483-8833.
Easy to find.
So wrapping this up, what's the big picture here? This deep dive into the ILAPEO training, it really highlights a serious dedication to lifelong learning, doesn't it?
It really does.
And sharing knowledge globally, but ultimately bringing it back to benefit the local community, your community. It's about making sure your care stays right at the cutting edge, informed by the best from around the world.
And maybe it leaves you with a question to think about. You know, in today's world, with information moving so fast, how much do you value having a healthcare provider who actively goes out, learns these global advancements, and brings them back to their practice?
That's a great point.
This kind of journey, like Dr. Pohl's trip to Brazil, it's really proof of that belief that true excellence, especially in healthcare, isn't static. It's a continuous pursuit, always expanding, always learning, and always coming back to serve you better, making sure your health is in truly dedicated hands.